Hello and welcome to the second video of our Pediatric Cardiac series. In this one, we're going to talk about two common forms of vasculitis. Now, while we're only talking about Kawasaki disease and MIS-C, it's important to know that there are many different forms of vasculitis. They're usually classified by the size of vessel that they affect, such as small, medium, and large vessel vasculitis. Kawasaki's disease is probably the most common and most widely known systemic vasculitis that we can see in pediatrics. There's 3 stages of Kawasaki disease: acute, subacute, and convalescent. And basically all Kawasaki's disease is a vasculitis, or inflammation of blood vessels. If you keep that in mind, the clinical manifestations that we're about to cover will make a lot more sense. For example, think of anywhere that you have capillaries or small blood vessels. If those were inflamed, what would it look like? Well, they would be swollen and red. And so we can see that in the hands and feet. In fact, it even makes the skin peel. You would also see conjunctival injection or red eyes, but without the exudate that would make you think they had pink eye. The small vessels in your lips and your tongue can also be inflamed, causing them to be red, swollen, cracking, and it actually makes your tongue look like a strawberry. You can also get a rash, as well as lymphadenopathy. The diagnosis of Kawasaki's disease is going to be made by the presence of fever, as well as 4 out of 5 of these findings. However, in addition, we're also going to check laboratory tests. And we're going to check any tests that have to do with inflammation. So like you'd expect, there would be an elevated white count. There'd also be elevated markers of inflammation, which include ESR, CRP, and it's important to know that the platelets also increase. So thrombocytosis is expected, and we're going to talk about that in the treatment section here in a moment. We take Kawasaki's disease very seriously because it can cause aneurysms of the coronary arteries, potentially disrupting blood flow to the heart muscle. We can look for these in a patient with Kawasaki's by using an echocardiogram. There are 2 common parts to the treatment of Kawasaki's disease. The first is IVIG, or intravenous immunoglobulin. Think of IVIG as an immune system reset. Often, we'll give this in a single infusion. Because of the likelihood of a reaction, we'll usually start the infusion slowly and gradually increase it, per the institution's protocol. Due to the coronary artery involvement, we're also going to administer aspirin. This is one of the only times that it's safe to give aspirin to children. Low-dose aspirin is the most common because of its antiplatelet aggregatory effects. The nursing care of the patient with Kawasaki's would include monitoring their cardiac status carefully. You'd want to be doing careful I's and O's, giving fluids, as well as assessing them for any signs of heart failure, which could be related to involvement of the cardiac muscle. Multisystem inflammatory syndrome, or MIS-C, is a syndrome that became popular with COVID-19 and the pandemic. It's also a form of vasculitis. However, it tends to affect more organs and have more cardiovascular involvement than you see in, say, Kawasaki's disease. Potential clinical manifestations you can see of MIS-C include almost everything that we talked about for Kawasaki's disease, including fever, but also abdominal pain, headaches, vomiting. But keep in mind, you'll still see some of the others, such as peeling skin, red eyes, or inflamed lips. Because MIS-C is related to COVID, part of the diagnosis is proving that they had COVID. We also want to rule out any other plausible diagnoses for what's going on with them before we say you definitely have MIS-C. The understanding of MIS-C is still evolving. However, some of the common lab findings are associated with the inflammation, and there would be things that you would already expect, such as your CRP and your ESR. For the remainder of these are all basically also markers of inflammation.